We've been working very hard, but much of it has actually been behind the scenes. So since 2022, we started to prepare for this project. We had about 80 WCB employees who started this process in the background working on the project. To do that, we actually started reaching out to across the country to other jurisdictions who have actually been covering this type of injury for a while. We wanted to understand what their processes were, but also what was working well for them, what wasn't working well for them, and what they would actually do differently or keep doing the same. This was all with the understanding that we wanted to best position ourselves. We actually learned a lot from them, and they were really generous in sharing their resources and their knowledge with us. Our policy consultations earlier this year actually broke attendance records. We used webinars to engage audiences, and we actually had more than 700 people sign up for 2 sessions. We took this feedback from the consultation to inform our final policy, which was recently approved by our board of directors and published on our website. It's also on My Work Matters, so if you haven't taken a peek at it, I strongly urge everyone to go take a read. In regards to our readiness, we actually started to recruit GPI team members last November, and we started training this April. We've also had conversations with employers and workers, and this was really key. Since January, we've actually held 7 webinars, 9 in-person events. We've sent out 6 newsletters, and we have a dedicated email that is published externally, so workers and employers, as well as our internal staff, can reach out to us with any questions that we have. We've also created some vendor agreements with 3 mental health service providers, 2 of which are brand new to Nova Scotia. So this means that workers are going to get timely access to treatment, as well as a program dedicated to support this type of injury. We've also entered into new contracts with investigation and mediation services. So this is a net new service that we're adding to WCB. So this is the first time we've initiated in these types of services. And the goal is for these providers to assist our eligibility specialists and case managers in reaching timely decisions, but also allowing workers and employers to engage in mediation services to see if they can come to an agreement in relation to accommodations or anything like that. But finally, in a big piece of the work that we've been doing, we've been really busy supporting workers and employers with resources to better understand what is a gradual onset psychological injury, but also what it isn't. We also want to help them build and maintain psychologically safe and healthy workplaces, but also help in the prevention of these injuries. So this includes a net new website, some new online resources, and a wonderful self-assessment tool that's going to help workers and employers really determine, am I experiencing a GPI or is my employee experiencing a GPI injury? So we have a September 1st implementation date. So that is a week away. And at that time, our GPI team is going to put all of their training into action as we begin to respond to these GPI calls and claims that get submitted. So now I'm going to turn it over to Heather.
Okay, good morning, everybody. I'm going to start by touching on some information about the policy. So as you may know already, the final policy is approved and posted on the WCB website, which was announced a couple of weeks ago. And just to note, a lot of work was completed to get to that point. As Kelsey alluded to earlier, it had the most ever submissions for a consultation, and it was informed with input from both workers and employers. So the policy really provides excellent clarity and guidance, and is available on our corporate website policy section. It's under What's New. And also of note, Bill 332 is available on the WCB Act page. The government will update the Act soon to reflect the new policy. Okay, so I'm just going to speak about the definition of bullying and harassment. So with the rollout of GPI, it was really important that the definition of harassment and bullying was as clear as possible and also consistent. So government is adding the definition for workplace bullying and harassment to the Workers' Compensation General Regulations. Adding this definition will ensure bullying and harassment are consistently interpreted across the workers' compensation system. And this definition is consistent and articulated within our new psych injury policy. And you can see it there on the slide, the full definition. So this consistency will really ensure a consistent definition that everyone will work from across the system. So through us here at WCB, throughout in government, through employers, WAP, WCAT, and so on. So just to talk a little bit about our GPI service model, the legislation, policy, and definition are foundation pieces of our new GPI service model. It incorporates new approaches and positions in a way that's aligned with our strategic plan. And over the next few slides, I want to tell you a little bit more about the new model. So right from the onset, we knew that setting up services to cover this new type of injury for Nova Scotians meant an opportunity to look at all aspects to build and improve upon the ways we deliver those services. So we'd like to take you through a scenario to demonstrate how someone will experience our new service when they first contact us. So we're going to talk about Sam, and Sam calls our main line, believing they may have a GPI. Sam is directed to our pool of CCNs, who may ask a few questions to help determine whether their situation meets the legislative criteria of a gradual onset psychological injury, meaning was there a significant workplace-related stressor or series of stressors, and potentially is there a DSM diagnosis to date. Based on the information provided, Sam, in this case, decides to open a claim when he talks to that CCN. His claim then goes to the eligibility specialist, who will review to make a decision on the claim, and more about that from Kelsey in just a little bit. In the meantime, while we determine that entitlement, we will be helping. So we will be referring to and working with community mental health supports, such as those found through Nova Scotia 211 and Access Wellness. And just want to make a point there, we have some good presentations from our CCNs on 211. So it's an excellent, if you haven't signed up for those when they've been available, it's an excellent opportunity to hear about what 211 has to offer and what that partnership means. We will also at that point start the conversation. So this is still talking about the CCN's collaboration with the worker and the employer. So we will start the conversation about stay at work and return to work with the worker. We know that staying connected to work the whole way along is so key. The CCN will work with the worker in this stage to maybe brainstorm some ideas about options for staying at work or maybe accommodations. They can help the worker with how they should approach their employer and provide support and facilitation of that conversation. We also know that employers have a huge role to play in staying at work and returning to work. At this stage, the CCM will also work with the employer to help provide direction and guidance on how they can create a supportive workplace, how they can engage with their employee and reach out to encourage that employee to stay at work or hopefully return to work. The employer's role will be essential in helping keep the employee at work or bringing them back to work in a safe and timely way. So in terms of some examples, and what will workers and employers notice is different right from the start in the service of this new type of claim. So there are new positions performing new tasks. A client care navigator will help both workers and employers right from the start. This happens once we know about a potential claim, even before that claim is decided upon. As I said, they will work with the worker, the employer, and the services available in the community. And sometimes they will be able to influence change so that what might have led to a psychological injury ends up becoming one that is prevented. How will they do that before we are even able to directly fund services because there isn't a claim yet? They aren't in it alone. They will be supported by mental health services and by the excellent Nova Scotia 211 system. Of course, meanwhile, a dedicated specialized adjudication team is looking into the claim to understand the stressors, to work with both the worker and the employer toward the right outcome with clear and transparent language along the way. Throughout it all, both the worker and the employer will notice a distinct focus on work connectedness. And obviously, the worker probably can't work in the exact situation that led to the stressor without some changes. But except in extreme circumstances, our research would suggest there's almost always other work that can be beneficial for both the worker and the employer to find a path to move forwards, while also addressing the core issue that led to the psychologically hazardous situation. And now I'm going to turn it back to Kelsey.
So Kelsey is actually having some connection issues, Heather. Would you be able to, I can see that she's frozen here on the screen, so we're just working to get her back into the session. Do you mind just picking up for Kelsey while we work to get her back in? Okay.
Totally. No
Thank you so much. I will click to the next slide, meet the GPI team, and you can take it from there and we'll work to get Kelsey back in. Thanks, Heather.
Kelsey, if you can hear us, you can interrupt me at any point and I'll pass it back over. But
Sounds good.
yeah, okay.
Thanks, Heather.
So run it with it here. So we're just looking at our team. So as you can see through our lovely pictures, our recruitment for WCB's new GPI team began in November of 2023. So our team consists of 6 client care navigators, 4 eligibility specialists. Actually, that is not true. We actually have 6 eligibility specialists. That's a typo. 5 case managers, of which we have 4 hired out of the 5. We are supported by 3 return to work assistants and 2 return to work specialists. So as I had talked about earlier, the new roles would be the CCN role. So that being the first point of contact for workers and employers on GPI related claims. And the CCNs are responsible for guiding workers and employers through claim complexities, coordinating referrals to community resources, and assisting with claim registration. And then we have our eligibility specialists. And as I said, we have 6 eligibility specialists. They manage entitlement decisions for GPI claims. They conduct, coordinate investigative analysis to determine eligibility and communicate decisions, ensuring decisions are fair and impartial to promote trusting relationships. And just to highlight, the team has been through quite a bit of training since we began in April with the start of the CCNs. And the training has been included trauma-informed training with the worker at the center of all the training and all that we do. I think I see Kelsey maybe unfrozen.
I'm back.
Okay,
Sorry,
that's okay.
Thanks, Heather.
No problem. I'll pass it back to you.
I am on my phone, so I apologize. So if we're on the next slide now, we're going to take a little bit of a closer look at what this is going to look like for the worker. So for starters, they're going to be actually able to call us and file a claim by phone. So this is something net new to the organization that we are going to be doing on the phone claim registration with the CCNs should a worker want to register a claim. They're also going to have access to that online self-assessment tool that we've mentioned a few times. So this is really a way for a worker and employers to answer a series of questions to determine if what they're experiencing is a gradual onset psychological injury, or if it's not. So when they go through the self-assessment tool, there's going to be a series of questions, and they're going to answer those questions. If they say that it's something like labor relations, it's going to come up to say that this is not something that looks like it would be eligible for benefits, and here's the reason why. And it's going to have that clear policy wording in there. However, we do support that if workers or employers have questions, that they can reach out to our client care navigator and discuss that. So this tool is really going to be a prominent part of the refreshed webpage on our GPI corporate website. And then, of course, as we mentioned throughout this entire presentation, we have a new service team that's going to be there to service these workers and these employers. So we want to help them understand what's next, what that claims process looks like, connecting them to those mental health resources and supports, and really guiding them from day one, regardless of entitlement or not, with the goal of getting them help. So this might be even helping an injury, preventing it from becoming an injury. So if we can connect them with those 211 supports, get them some of the treatment that they need before claims even submitted, that's something that we want to do. Another prominent part of the client care navigator's role will be having those conversations with the workers before claims accepted, discussing stay at work or return to work options as well. So again, pre-entitlement, we're going to be supporting in a different way than we ever have before. I'm going to move on to the next slide. So a question we hear a lot is, how will you access those mental health services and supports in a system that's already stretched? So earlier this summer, we did announce that we have secured agreements with 3 new mental health providers. So we do have an agreement with Homewood Health, who is providing some of those services in our TPI program. However, we have 2 net new providers, the Newly Institute and EHN, so Edgewood Health Network. So they're going to ensure that we have timely access for injured workers and expand access to mental health care across Nova Scotia. So we are really excited that we have 2 net new providers to Nova Scotia, as mentioned, to expand that mental health care. We do have some information posted about these service providers on My Work Matters, so I strongly urge everyone to take a peek at that post. So I know a lot of you have also had a lot of questions about what documentation is needed when it comes to these types of claims. So when our eligibility specialists reach out, they're going to be speaking with workers and employers, and something they're going to be looking for is, did anybody witness any of the events that you're describing to us, or you're looking to submit a claim for? Was there any investigation done? Was there any HR done? Was there emails? Was there texts? And again, a big part of that is going to be those witnesses as well. But in some of those complex claims where there may be some systemic issues, that's when we have the ability to bring in those third party claim, WCB claim investigators. So they will work with our eligibility specialists to determine the scope of their investigation, but also work with the worker and employer to determine who they need to reach out to and what type of information that they're looking to secure. So we do have 4 new service providers who are going to complete those inquiries. So 3 will be investigation, and then we do have 1 service provider as well that's doing mediation only. So we have Mobile Resource Group, MC Advisory Group, Latitude, and Homewood Health. So a big part of the RFP for these providers is to ensure that they are coming to the table with a trauma-informed lens. So we don't want the workers to have to explain their situation more than they need to. And we also want to encourage and confirm that we have evidence-based inquiries to gather the information that we need in order to make a solid claim decision. Again, there's a post on My Work Matters for these service providers, so please check that out. And I'm going to turn it back to Heather for our final few slides. And thanks for taking over for me, Heather.
Oh, no problem. Okay. So what can you do to support our service for GPI? So although our GPI team will manage the new claims, everyone can play a role in making GPI coverage a success. And I'd like to take this second just to thank everybody so far for all the incredible support. I think just on behalf of the entire team. So it really is appreciated. So if we look at prevention and return to work resources for going forwards, like any type of workplace injury, prevention is key. So employers have a responsibility to create a safe workplace and to manage the hazards within it. So we've compiled a lot of information on our websites to date, including the Psychological Health and Safety Toolkit from Saskatchewan that we've adapted into a Nova Scotia version. And this is a really great resource, and you can see there on the slide where the resources are located. Prior to launch, we'll have a refreshed GPI section on our corporate site to share, which will include the self-assessment tool for workers, which Kelsey talked about earlier. We also have adapted a return to work toolkit as a guide for employers on healthy recovery for psychological injury from our colleagues in Saskatchewan. So these are all resources that certainly you have access to and would be great to have a look at. So when you have a moment, just have a look at the websites and you can scan the QR codes to learn more. So in terms of GPI inquiries from workers and employers starting September 1st, first, if you receive these inquiries, you can direct callers to the dedicated CCN phone line, and also you can refer them to our website. And I think, Katie, you posted the GPI email above. It's there again and in that slide, but I think it's also in the top of the chat. But that's another place that questions can be sent if you hear from workers or employers about specific questions that you know would be related to GPI. And with that, I am going to turn it back to Katie for any questions.
Yeah, so everyone, this is where we've arrived at the Q&A session, or a portion of our session, I should say. So by all means, if you have any questions related to our preparations for GPI, maybe a question for Kelsey or Heather from the presentation, by all means, pop them right there into the chat box. Alternatively, if you want to put your little hand icon up, I can click on you and unmute your mic and you can ask your questions. So we'll just give it a few seconds here if people have any questions that they want to ask. There we go. We have a question from Jillian. So I'm just going to pop on over here to Jillian. And Jillian, you should now be able to ask your question. I have Jillian unmiked, so I'm not sure.
Oh, wait, can you hear me now?
There you go. Hey, Jillian.
Okay.
Yep.
Okay, great. I have 2 questions.
Sure.
And and they're coming from a non-caseworker, so apologies. But I think in a physical injury, WCB pays for first medical. I may be wrong on that. Is there a GPI equivalent? Like, do we pay for first psychological medical for GPI claims? Is that a question?
Heather or Kelsey, I'll let you take one of those.
I'll jump into this one. So Jillian, if we do require some medical in order to determine a diagnosis, we will be setting up a worker with a diagnostic assessment, and that is something that WCB would pay for.
Perfect. Okay. And then I think you mentioned 211 or 311. I can't remember which one is the mental health and which one is the like tree trimming, sidewalk clearing. But are they staffing up? It sounds like they will be heavily using them for GPI claims. Like, are they increasing their resources based on sort of our potential referrals to them next week?
I can take that one. I don't know for certain that they are staffing up. I think that they are certainly aware of what's coming. And kind of where we are, and there's a really strong, we've built a strong connection through, especially through the CCNs and the work that they've done with them to get ready and to have that good communication open. To my knowledge, I'm not sure organizationally where they are, in terms of staffing up, but hopefully if this is something that brings lots of business their way, and 211 encompasses a lot of things. So that's one of the things about 211. It's a lot more than we could even cover off. I can't remember, Kelsey, the number, if it's 200 and something, like access to over 200 types of services. So it's not just psychological services, it's financial services. It could be food services, like in terms of like food banks, and it's all those types of resources. So now obviously they need staff to be able to help direct people to the right resource they need. But again, I mean, hopefully, they can handle the help that we're going to be looking for. And I'm not sure if that answers the question, but to my knowledge, that's where it sits right now.
Okay. So is their role to provide the services, or are they really directing people to community services?
So it's more of direction. So it could be a bit of both, but they generally have access to. So if somebody needs, for example, one of the examples that has come up is if a worker, and this could be across claims, not just for GPI, but if a worker has a spouse who is really struggling and it's really impacting our workers' ability to improve because their spouse is also now not doing so well, that would be access that if they call 211, 211 might be able to help them to direct them to a service that can provide some support and access to them. Same with if someone says, you know what, because I am now on a workers' compensation claim, I do not have the same income as I had, and I'm really struggling financially, then 211, they would, go through an intake assessment, just determine what their needs are, and then refer them to the right resource that can help with their financial situation.
Okay.
And then same for psychological help as well. Like if there's a need in the beginning for psychological services of some kind, they will also help determine what psychology services or counseling services might be available.
Gotcha. Okay, so they're more of like a navigator, right? Like a province-wide navigator.
Yes.
Okay.
Yeah.
Thank you for the clarification.
That's awesome. Thank you, Jillian, for those questions. And similarly to Heather, thank you for the informative answer. So we're just going to take a couple of questions from the chat, and then we do have another hand up. But I'm going to go over here to a question from Sarah. And this question actually comes from an employer. But Sarah asks, if someone has a physical injury and a GPI injury, will both claims be managed by the GPI caseworker?
So I will take this question. As our famous phrase, it depends. So of course, depending on the mechanism of injury, if a claim comes in and there's a physical injury, and then we realize when we're doing some accommodations or return to work that there's bullying and harassment, that's something that you would discuss with your manager and come to GPI. The thing that we want to really focus on is ensuring that workers are at the center. So a claim may be handled in the GPI department based on the fact that maybe there was an assault. It was not traumatic in nature, and it came to us because there was a psychological component to it, but they also had a physical injury. So we would look to set them up with those physiotherapy services or what they would need to manage that physical aspect. But again, we just really want to ensure that we're not moving the worker around to multiple different case managers or different people. So there will be a process that is in place when there is, you know, two elements to that claim, and that's something that will be published, I believe, in the next month or so.
Perfect. Thank you, Kelsey. Carrie wants to know, will we be, we just got another question, so we'll just go back up. Carrie wants to know, will we be putting the Client Care Navigator direct line to Interaction Client so it can be found easily? And just to clarify, is it eligibility specialist or entitlement specialist? And that question comes from Carrie. And Heather or Kelsey, either one of you.
I can take this one. I'm going to be honest, I don't know if the direct line will be in Interaction Client. I believe it may be. We do have a queue that our Client Care Navigators will be working out of, but Carrie, I'll look into that question and loop back around. And then it is eligibility specialist.
Perfect. So it's eligibility specialist. Awesome. Thank you, Kelsey. We're actually going to go back to the attendees here. We're going to take a question. Jana has her hand up, so I'm just going to unmute Jana's mic. And Jana, you should be able to ask a question now.
Okay, perfect. Thank you. So I'm on SA2, and I've had some claims come in that currently don't meet our legislation, but potentially could come September 1st. Have had some of these workers ask if time loss will be considered prior to September 1st should their claims be accepted under GPI, and they've been off prior to September 1st.
I can grab that one. So yes, the effective date to submit claims is September 1st. However, Section 83 will apply to claims. So that's something that our team will be really focused on when they are rendering those decisions and doing their investigative analysis for claim eligibility.
I'll just jump in quickly as well. I just to let you know, the policy team's coming to meet with SA 1 and 2 to talk about the new policy and the impacts, as well as some of the timelines around Section 83, so we can get into some greater detail on that. I think it's tomorrow that's scheduled.
Perfect. Thank you. Thank you both.
Great. Thank you, Jana, for your question. And we're going to hop back over to the chat box where Tammy has a question about when GPI comes into effect in just a few short days here. And Tammy asks, how many calls are you expecting to come in next week regarding GPI? Will ISA handle these calls, or will they go to a CCN, a Client Care Navigator? And how many new claims do you expect next week? So that question comes from Tammy Poirier. So it might be hard to say, but Heather, I think you might have a little bit of an answer here.
Well, I definitely have an answer for the easy part of it, which is, will ISA handle these calls or will they go to the CCN? I'll answer the easy part first, which is they will go to the CCN. So those initial calls will go directly to the CCN. How many calls we expect next week? We don't know, but we are ready. That's the part I can say. We don't know. I mean, we have numbers about what we expect once we are stabilized and as we go, and there were numbers that were used in coming up with appropriate staffing levels and to take this on. But for next week and the week after, we truly don't know, but we do have like I said, we're ready. We're in for the first 2 weeks. Our CCNs are definitely ready. We definitely have the support of the ISA, so we also have them there at the ready for things that we might need, even for technical glitches or in case it's lots of calls. So I'm not sure. That's a very not clear answer, but we at this point, there's no estimate of numbers specifically. If anybody ever has a better guess or number to put there, Kelsey?
No, Heather, I think you hit that perfectly.
Great, thanks, Heather. Okay, so we still have time for a few more questions. If anyone's got them, you can put your little hand up. You can pop it into the chat box. We'll give it a few seconds here if anyone has some more, and if not, then we can wrap up. I don't see, I'm just taking a look here at the participants, and I don't see any hand icons up so far. And just going back to the chat box. Kelsey popped in there the extension for the direct line. Thank you, Kelsey, for doing that. So I'll just remind everybody that I pinned at the top of the chat box here the email address for our GPI hotline. If you have any questions related to GPI, by all means, please feel free to send us an email. So I think we're done for questions for now, so we can wrap up. I want to thank everybody for taking time out of their morning to join us, and especially thank Heather Dunford and Kelsey Daly for taking time to walk us through that great presentation on how we're getting ready to support GPI. It's crazy to believe that this is all coming into effect this Sunday in just a few short days, because it feels like yesterday that we started hosting these webinars and that we started talking about GPI actually coming into effect and it not just being something that was going to be happening in the future. So thank you to everyone for joining us today. Whether it feels like it or not, come Sunday, September 1st, more workers are going to be protected, period. And that's fantastic. So it might not feel like when September 1st rolls around that things are changing, but it's crazy to believe more of the workforce in Nova Scotia will be protected. And I know there are so many people joining us on today's session who have had a part in this. And whether you feel like you've had a little part or a big part, we've all had a little bit of a hand in this. So way to go, everyone. Congratulations. This is just huge for working Nova Scotians. So with that being said, I know on behalf of the psychological injury team, thank you, thank you, thank you. And to be honest, congratulations, everyone, for all the hard work you put into this over the last few months, really better part of a year. And I anticipate even before that, to be honest. So have a great day, folks. And thank you, Kelsey, Heather, and thank you, Kevin, as well. And without that, enjoy your day. Thank you.